Hello and welcome back to my channel. Today we are going to introduce you all to our new and exciting procedure called Factor 4. For Factor 4 you need to get your blood drawn 6 to 9 hours prior to the procedure. The blood drawn then is placed in the incubator for that 6 to 9 hours, exposing blood to pyrogenic free surface and rapid increase in the synthesis of growth factors. We have 3 patients with us today with 3 different conditions. One with acne and acne scarring. Second one has got open pores and uneven skin tone. And the third one has got alopecia areata. Now, alopecia areata is a health condition which causes hair loss in circular patches. This happens when your body's immune system mistakenly attacks your good and healthy cells. In our patient's case, it has attacked his beard. All my patients has already had their blood drawn this morning and now they're back with us to get their procedures done. And they're patiently waiting for their procedure. We have Sean Baldwin with us today, who has many years of experience in this industry. Sean is going to explain to us how each procedure is done. I hope you all enjoy our video. Please don't forget to like, subscribe and share our video. Here comes Sean for you.
Factor 4, and what we're doing now is just removing the plasma from the device that we've got, that we've done earlier. We've just been incubating. We're just going to take this down and take the plasma that's in this device now out into the syringe above, extracting it as we go. Trying to get every last bit of it because we want all of the plasma, and we're trying to avoid getting any red cells in there. Beautiful. So that one's full. Just going to recap that, put the lid back on. What we're going to do now is do the filtering process, and this is the really exciting part, because what we're going to remove is the cellular matter that we don't want in the plasma, converting it to liquid gold. We love liquid gold because it's good for the skin and the hair. And we're going to convert this now by pushing it through the filter. Look what happens. So see the pure colour that we get? It's incredible. Big colour difference between plasma and serum. We'll just take that out slightly now. Just reduce that and put it back into the top of the syringe. I can get back in there. And push it all the way through. And that's the process done. Very, very simple. We have all the blood that we want for the patient. We now have the treatment, and we are ready to treat the patient with their serum. Liquid gold. This is Factor 4. I'm just going to clarify, this is your syringe. Angie Nunes. Your date of birth is 15th of the 6th, 1979. We have the correct syringe. And then all I do is just simply put this into the skin very, very quickly. It's just a skin prep that I like to use, Shubeda. So you can see how it just sits on the skin.
Yeah.
Okay. I have my syringe in one hand. I'm going to drizzle some Factor 4 just onto the skin. So see how it comes out? And a fine mist like that. Okay. I then grab my derma. I'm just going to do a little test, okay? And we just do 3 quick passes. How does that feel?
It's good.
Feels numb? That's okay?
Yeah.
So what we're looking for is erythema and petechiae, as you well know. So we want to get some redness in the skin. Haven't quite got there yet, so we're going to go just slightly higher. Do another test pass on the other side. You okay?
Ready?
Yeah.
You can feel it a bit,
yeah.
feel it a bit more? Okay. So you can just see it's just starting to come through now.
Yeah.
Bit slow to react. Okay. So we're going to start from the top and work our way to the bottom. Tell me how that feels.
Yeah.
Any pain?
No.
No pain at all?
No pain at all.
So Shubeda, what I'm looking for in my first pass is to see how the skin is reacting, to try and get some erythema, obviously, and petechiae. I'm just making sure that I'm getting a nice reaction. I can see there's erythema coming through now. 10% overlap.
Yeah.
You can feel that, can you?
Yeah.
Okay, so you can see there's a reaction coming through now slightly. I'm not going to push any higher than that in terms of my depth, but I am going to do 3 passes, and that's what I always do. So put some more factor 4 on, onto the skin, okay? Pass number 2. From the middle, come all the way out. Nice, long, even strokes. There's an evenness to it. I can feel there's still some glands, sebaceous glands that are a bit full there, so we're going to give it a good wipe when we're finished. Okay, she's still comfortable. Her hands aren't in the claw position. She's not jumping off the bed just yet. Okay. Pass number 2 the other way. Not quite so numb on this side, are you? Sorry, darling. You'll love me when you see me next time. You know, my skin's amazing. Look at my skin. Pass number 2, okay? Not quite the clinical endpoint that I want. So because she's tough, she's from Brazil, Venezuela? No, Colombia.
Colombia, yeah.
So tough in Colombia. Okay, so pass number 3.
So what's that gap?
I'm at 1 mil.
1 mil. So what did you start off with?
I've started at 0.75.
Yeah.
And she can feel that now, and I'm going to go really, really quickly. Be able to look at it, see the reaction we're getting now. That's what we want. I'm going as fast as I can. Good girl. All right. Get some factor 4, and then just rub it into the skin. So this hand's not touching anything else. I'm keeping this hand very clean. You all right, darling?
Yeah.
You're doing a good job. Feel that one just there. I'm going to go crazy, okay? All right, turn your head to the right for me, please.
Is that sebaceous hyperplasia or just
Yeah, but no, you haven't.
I have.
Feel that. Now,
It's not sebaceous hyperplasia. It's just.
It hasn't formed yet.
Yes.
It's just there.
Yeah.
Now, if she was more numb,
Yeah.
I would actually stamp it to try and break it up. I'm not going to do that. Okay. Okay. Turn your head all the way over for me. There we go. Flatten it out. Factor 4 goes on. Be quite generous with your factor 4. You've got plenty to use. Okay.
Yeah.
We're on 1 mil. Because his skin's thicker, we're going to go up to 1.5. Okay?
Yeah.
Start from the top and come all the way down.
Okay.
You okay?
Thank you.
Do you prefer it slower or fast?
First.
Fast?
Okay.
Okay.
You alright?
Yeah.
Are you tough? But that's pass number 1 at 1.5, so good clinical endpoint, okay? Pass number 2, coming underneath the jaw.
Yeah.
And I try and move fairly quickly. You can see I'm putting a bit of pressure in there. I really want to try and get some of that scarring to start breaking up.
Yeah.
Look at that. That's pass number 2, okay? Pass number 3, keep moving. Can I have some gauze, please? What I'm going to do is just wipe this as I go. Because she's got some active acne there,
Yeah.
I want to get it off the skin. Just blot it off the skin. Okay? Get your factor 4. And massage it in.
So you did 2 passes?
3.
there?
Everything's 3.
So you did 1 that way.
So 1 down this way, 1 this way, and then 1 to go that way again.
Yeah,
Okay?
Okay.
Okay, other side, sweetheart. All the way over. Factor 4. So you see how fast you go, girls? Okay?
And that's 1.5.
This is 1.5.
But if they're feeling it, like, can we go down?
What's that, sorry?
Like, she's feeling it, like, I think it's hurting.
I would have
if
put
it's
Glad Wrap on her, occluded it to go deeper.
So we can put it.
Occlude. I always occlude. Okay? She's doing all right. And I'm going as fast as I can because I don't want her to hurt, but I want her to get a good result. You know what I'm doing? I'm moving as fast as I can.
I did that on yeah, that's what you do that.
Okay, get some gauze. and blocked. Get as much of that bacteria off the skin as possible. Get rid of that. Some factor 4. And massage it in. You okay?
Yeah.
You're doing really well. You're looking at $100. He's still laughing. Beautiful. Okay, back to neutral for me. Okay, so you can see the air is coming through. All right, chin up for me. Chin there. Okay, just hold it. Back to 4. Okay, and just massage.
Yeah.
You can see it's
Already,
breaking up.
yeah.
Okay,
Yeah.
it's breaking up the pitting. Okay,
Yeah.
okay, just relax for me. There you go, good girl. All right, so now that's it. Got the nose to go. We're done.
Yeah. Oh,
So it takes 15 minutes. It's not fast. You're next, mate.
Just keep your eyes closed. Yep.
So I try and leave about half a mil left over in my syringe.
Yep.
Okay.
Okay.
The nose is slightly different, so we're going to
Yeah.
just turn it down a bit here. Okay, here we go.
Yep. You okay there?
Yeah.
Nose is
You
fine.
all right?
Yeah. Oh, you're a good girl.
Are you loving me or hating me?
Liking it.
You're gonna love him once it's
Yeah.
done.
Oh my god, that guy, he came and did my skin. He is so good. He's so hot. You got a boyfriend?
No.
Oh, okay. You was going to say you go and tell him that you had this guy. So push the skin there and just get it on
Yeah.
that side. See that? Mm-hmm. And then do the other side. Push the skin. Just get it in there. Okay. Have you had an earring in there before? No?
No.
Okay. Sorry. All right.
Get a bit of stamping there.
Yeah, it's just a bit of a. Okay. This is so good to be able to reduce the pore size. So that's that. So
Yeah.
turn that off. I've got half a mil left over and just get it into the skin.
So you don't do these areas?
I'm not going to today, no. She doesn't need to. She's
But
20.
you can. if
Yeah,
you
yeah,
want to.
absolutely.
And
yeah.
is it still 0.25?
That depends on the skin reaction. 0.25 to 0.5, 0.75 on some patients, male skin. On mine, 0.75. Other side.
How about your lid?
Sorry?
Eyelid?
Eyelids? Yeah. Depends. Everyone's different.
Okay.
You alright? It's Halloween today, do you know that? You look like roadkill.
Oh my god.
I'm just joking. You look fantastic. Okay, what I am going to do though is just one quick thing.
Yeah.
Just turn it down, 0.5. Watch this.
Yeah.
Alright. That's even nice. That is it. This is just a bit of moisturiser, just to help with the. You feeling alright?
Yeah.
Your skin feels hot and tight, like you've got mild sunburn?
Yeah.
Perfect. You haven't got a date tonight?
No.
Good. You'd scare them. No, I'm just joking.
Is it like hydrating serum or?
Yeah,
it's,
hydration, pure hydration. And that's it, done. Alright?
Wow.
So do you put the sunscreen on?
Sorry?
Do you put the sunscreen on?
What is it? It's 6 o'clock? I think it's fine.
Normally we do.
Yeah. Absolutely. You done, love?
Done?
Yep. Okay.
I'll give you a mirror to have a look at.
and go and get a moisturiser, a small one, it's about $9.95. It's called QV or Cetaphil. Okay. And just put it on your skin every couple of hours for the next few days. Okay. All it's going to do is hydrate your skin, but there's no active ingredients in there, and there's nothing called parabens, which we don't want you to go into your skin. Okay. So that's what you need to do. All right.
Yeah.
And I can already see the smoothness going to come through here, so you're going to get a good result. All right. Easy.
All right, thank you.
Okay. So Shubeda, we're going to do Tiari's Factor 4, which you've just taken on Factor 4 in your practice. And what are your thoughts so far of what you've seen today with Factor 4?
I'm so excited about it, to be honest.
Can I ask why?
I'm seeing a few patients already, and their skin is just amazing. Oh gosh.
Tiari, how's that feel? Any pain? You're okay? Okay, that's good. So we're off to a good start. We put the Factor 4 on the skin. We've got the M-Derma, which is our skin needling device. And we're looking for a clinical endpoint, as you well know, of erythema and petechiae. We haven't quite got it there, but I reckon after 3 passes we'll be fine. So we're going to go. If it starts to hurt Tiari, please tell me, won't you? Okay, and here we go.
So is there any side effects of Factor 4, Sean?
What was that, sorry? Say it again?
Is there any side effects?
There are side effects in terms of what skin needling does with Factor 4, absolutely. And often the patients are going to be red for, 24 hours sometimes. It's really important that, particularly here on the Gold Coast, that when the patients leave here, they've got sunblock on. If they go out in the sun the next day, that they're wearing sunblock. After effect, that redness coming through, it's beautiful. She's got radiant red skin already. We need to make sure that the skin's protected, so no washing her skin tonight, Tiari, okay? Thumbs up, so she's listening to me, but she's concentrating intently on the pain. That shouldn't be too bad. Look at that clinic we wanted to, but we're getting a release of TGF-beta1 and all the growth factors.
A few patients that's got a lot of acne scarring and scarring as well, and also with acne. And people with uneven skin tone and also pigmentation as well. I'm really focusing on hairy growth too. Patients with alopecia or metastatic wellness, or somebody that's going through chemotherapy as well. That will be really great for them, and I thought that will help a lot of patients do that.
And it's quite surprising how many patients are actually going through that dramatic trauma in life. And that's easy. So we've done 3 passes on the forehead. We'd like to see a bit more spot bleeding, which would be good, but this is a perfect clinical endpoint in terms of erythema and the patient's comfortable. Shubeda, can you turn your head to the right for me, please? There we go, a little bit further over. There you go. Okay, you get the Factor 4, goes onto the skin, okay? Just sits on the skin beautifully. And the good thing about Factor 4 is you'll notice the patient's own serum, nothing's gone in there apart from their...
Now, do you have a few patients that, focusing on anti-aging as well, with deep, fine lines and wrinkles? So how does it work with the wrinkles and fine lines?
Fine lines and wrinkles are unfortunately a part of the aging process, and we have the ability, modalities like the M-Derma to increase the texture and tone of the skin. What I like about Factor 4 is it's regenerating the cell at a DNA level to be able to function. The aging process, unfortunately, is the body shutting down, but Factor 4 is rebooting the cell to work again. And that's why it's so exciting.
It speeds up the collagen production and the cell renewal as well.
Correct. We're increasing the energy in the cell. We're making the cell work again. It will just become lazy. It's not working as well as it should be. And we can see a nice response on the skin. And the other thing that's exciting is that the Factor 4 actually penetrates the skin very, very easily with the M-Derma. So it's a great response and a great clinical outcome that we get by skin needling the patient's own serum back into their skin. So massage that back in.
And what about the downtime of the Factor 4? Can you explain a little bit?
Everyone's different. It depends on their age. It depends where they come from. Are they male or female? Are they looking after their skin? What skincare do they use? Do they go in the sun? Do they stay out of the sun? How lived in is the skin? So these are the things that we have to factor in. What's really important is that we use A, we use B, and we use C. Our vitamins A, B, and C. That we're using a good skincare range. That we're using a good sunscreen. Other side, please, pick up. Turn your head over. and that we're making sure that we're doing all the things to feed and nourish our skin at a cellular level, and obviously externally as well. We've got to feed. The skin's a cell. It's the biggest cell in our body. How's it, Tony? You all right?
I'm not saying it's really good.
It's because I'm good, that's why.
That's good.
So you can see the first part, we get that nice erythema coming through. She's got lovely skin, a bit of scarring there from when she was younger, from a bit of acne probably. Am I right, Tiari?
Yep.
When you were 15, just about 5 years ago? Like all of us.
Yeah. Hopefully. Give it 8 weeks.
Look at that. Such an amazing clinical endpoint. Nice spot bleeding, nice erythema. Get that factor 4, massage it into those little micro holes that we've created and get all the goodness that's come from within the body to go back into the body. It's a way of rebooting and re-healing yourself. Bring your head back to neutral for me. Oops, sorry. We're almost finished. Very, very quick procedure.
It's the longest time that it takes is for the anesthetic, which is half an hour, but the procedure itself is very fast and easy.
So it is really easy, and also too, I mean, you know, I've got to pay kudos to the developers of the M-Derma, because the M-Derma does make the treatment faster and easier. So if you're using, you know, a different modality, it can be a little bit slower. But also too, well, you know, it's a procedure that you want to have done, and you want to make it as quick as possible, because you are putting needles into someone's face. So you know, you don't want them to be in pain. Just relax for me. Just relax. Just relax. Beautiful. Chocolate is often the worst part of the treat. You can see we're getting a good response there. She's kind of hating me about now. But,
So what sort of aftercare would you recommend?
So directly after care, we're going to do what we call a factor 4 wash, and wash your skin with a factor 4. Then we're going to put a HA on the skin just to hydrate the skin and get some nice ingredients in there to start the healing process. You'll go home tonight, you won't wash your skin for 12 hours, and then tomorrow when you wake up, you'll have a shower as normal, use your normal cleanser, you know, your normal skin regime that you're doing. No active ingredients until the redness of the skin is gone, and lots of moisturiser. Obviously, critical is sunscreen.
The sunscreen is very important, and also you might feel a little bit of dryness in the skin as well. So moisturize as much as you can.
Absolutely. Moisturiser will be your best friend besides me. You've got great skin. Apart from those little areas there, you've got sensational skin. No blood, it's not fair. What about you? What about you? Well, I was born with it.
Factor 4 has been around.
Factor 4 has been around for 20 years. The name Factor 4 comes from a device that we use called Olsen. So it's not new, it's actually really, really old. What's new is the application onto the skin and into the hair. Now I'm just being very careful because I've got that nose ring there, which I don't want to.
And a lot of people don't know about the Factor 4 that we can use on the skin, which we really want to get it out there and tell people how good it is and how it can really help the skin go smoother, the texture goes smoother as well.
Texture and tone is really important, but what's really exciting about Factor 4 is it's the patient's own blood. Nothing has been added into it. So there have been no additives to create the platelet or the blood to be doing anything other than what we're doing with the blood that we're getting from the patient and putting it and processing it, So it's just the patient's blood. Nothing has been added, and that's why it's so exciting. So the risk of infection, the risk of bacteria, the risk of anything going wrong with the skin, look at that glow. She's got a glow like she's never had before. It's her natural glow. Or the Shawnee B glow, I'm not quite sure. I'm just giving you a bit of a watch of your own Factor 4 now because you've got some left over. You've just got some dry parts of blood there. Now your face is going to feel hot and like you've got mild sunburn. That's very normal. So again, just to reinforce, because we're off the camera, do not wash your skin tonight. Okay. tomorrow when you wake up, have a shower, do all the things normally.
Yeah.
Just make sure that when you're outside that you've got lots of sunblock on your skin, because the risk of you getting what we call hyperpigmentation is a bit higher than a white boy like me, because I've got white skin and you haven't.
I understand.
And I'm not blessed and you are. So it sucks, really.
Not even. But that's what I'm trying to change, just like the pores. I just want to minimize the pores.
Can you put that? Yeah, just put that into my fingertips. Don't touch my gloves.
Yeah.
Keep going.
So that was all my
That was all your blood converted into serum.
Wow.
We still got some to use for your 4 treatments, 3 other treatments. Yeah.
So your pore reduction will happen over time. It's not going to happen overnight. If it was that quick, I'd be a very rich and wealthy man sitting in the Bahamas somewhere. But it's going to happen over time. And you've got great skin, but you have got some enlarged pores.
Yeah.
So we will get rid of those.
Yeah, we do have a lot of patients that do complain about enlarged pores. So this will be really great for those patients as well.
Good job.
So you can't wash your face today.
Okay.
And let the products work, your serum work into your skin.
Okay.
So as we are sleeping, our skin is working for us, and anything that we put on,
So this young man's got some alopecia going on in his beard, which is very, very interesting, because I haven't seen a lot of this before, but you can see it just here. And if you just turn your head, sorry, you can see it just here. So what we're going to do is we've prepped the skin and got the skin ready. Just lift your chin up that way. I'm going to put some factor 4 on here, and I'm going to what I call stamp it into the reticular dermis to try and stimulate some growth of the hair, the papilla. You can see there is some hair coming through there. Alopecia is really hard to treat because primarily it's stress related. Can be hormonal as well. Just going to get the factor 4 onto your skin. Okay, here we go. So I'm just going to push that down off the jaw and just very gently. How's that feel?
Feel good.
Feel good?
Yeah.
No pain?
No.
So what I'm doing is just getting this factor 4 and very gently trying to apply a bit of pressure and just stamp it into that deep part of his dermis. Past the papillary dermis and into that reticular dermis. You can see we're getting some nice clinical endpoints there. I am going to just do it a bit more, put some more factor 4 on it, and really just get it in there. And I'm going to just go slightly outside the area that we can see where the alopecia is. My hunch is that it could spread a bit more. Hopefully it won't. And then I'm just going to come through and just gently. Any pain there, mate?
It's alright.
You okay?
Yeah.
Not dying? We have a bit of factor 4 there, so I'm just going to. Sorry, mate. Can I have some gauze, please? Oh, thank you. Just I'll take it out. Thank you. Just a couple more drops here, mate. And then we'll just go across to the other side. So yeah, the goal here is to try and stimulate and excite the follicle back into growing again. I'm just going to massage that in. Those little micro holes have been opened. No pain there, Muzz?
No, it's all
You all right?
Yeah.
It's the first time I've ever done this, mate, so... No, just joking. All right, other side. Can you do me a favour and sort of lift your chair, lift up towards me? You all right?
Yeah, is that good for you?
Yes, good, yeah. Again, just trying to create these micro channels with the M-derma, not hurting. That's alright, then you can keep going. We're getting a nice clinical endpoint of erythema and obviously blood there as well. Because the papilla usually sits a lot deeper in the junction, I'm trying to get as deep as I can without causing too much trauma, and making sure that Mazir is as comfortable as he can be. But
What depth you are in there?
I'm at, what am I on? I'm on 1.75. So stimulate it, get it to grow. Okay. So a little bit of factor 4 left over. That's on that. Alright. Okay, so you can't shower tonight at all.
Shower.
No shower.
Okay.
If you have a shower, just do not put your face in the water at all. Alright? Hang on, there's a bit left over. It's been a fantastic day here at Aesthetic Skin and Laser Clinic down here on the Gold Coast. Shubeda, welcome to the Factor 4 family.
Thank you. I'm so excited.
You can see what you're going to do with this. You're going to run amok and make skin look amazing on the Gold Coast.
Just like mine.
True.
See, I'm 50 and I don't look 50.
Not at all. Not at all. But if you have got any questions about Factor 4 and skin needling with the M-derma or skin needling in general, any skin concerns and you want to ask Shubeda about them, please contact them directly. Come and see them directly.
Yep.
Ask all the questions, find out all the answers,
Yep.
and make your skin your best skin possible.
Exactly. And thank you for watching. And I'd like to thank you, Sean,
My pleasure.
for coming. And
Absolute pleasure.
it was lovely to have you here
Had a
today.
ball.
Yep.
Had a ball, made skin look amazing.
Yep.
Thank you.
And don't forget to like and subscribe our channel. Thank you very much.